and introduces one member of the group hosting this dialogue today. The group is called the Media Task Force of the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement. As COVID-19 vaccination programs are rolled out throughout Africa, so too are rumors and deliberate attempts to misinform the public about the nature of the virus. Journalists not only need to counter fake news with accurate coverage of the pandemic, they also have to keep in mind that if they're putting out the fires of fake news, they also risk shining a light on misinformation. And the tricky thing is not to spread that misinformation even further in doing our jobs. Today we'll have one keynote speaker talk to us about how widespread misinformation about COVID-19 and vaccines is, and how damaging it is in our fight against the virus. We'll also hear from an Internews Pandemic Media Mentor, who will provide advice to journalists and other content creators who are grappling with the sheer volume of COVID-19 information and that parallel track of misinformation that's going on out there. Before we get to that, though, I'd like to hand over to my co-moderator, Tole Nayata. Tole is an Internews Pandemic Media Mentor based in Nairobi, and he's going to update us on the media community feedback our working group has collected recently. Tole, over to you.
Thank you, Wayne. Thank you, everyone, for joining and for giving us your time. Christophe, if you share the slides. So the RCCE partners have ears across the ESAR region, and these partners usually collect feedback from communities, and it is from this feedback that we come up with topics for conversations. So what usually happens is we pick the feedback as poll questions, and then participants will choose which one they think is the most important for us to tackle in the next dialogue. So thank you very much in advance for taking part in this poll that will be put up later by my colleague Christophe. So as you see, this is what we are getting with regards to COVID-19 and the vaccine. With regards to perceptions and rumors, from Kenya, we are having concerns. They are saying, let me wait and see how those who have received the vaccine will react fast. And then also from Kenya, there's a concern the vaccine development was too rushed and may not be safe. There are reports that people are dying from blood clots. There's also a concern from Zimbabwe. They're saying, why is AstraZeneca only being used in Africa? We don't want to be guinea pigs. Another concern from Kenya is the corona vaccine is a method of family planning. We have the British Army is responsible for the current COVID-19 wave, also a concern from Kenya. And you can not get vaccinated unless you test negative, or no COVID test is required before vaccination. That's a question also posed from Kenya. From Southern Sudan, Somalia, and Kenya, we have concerns, people saying Muslims will not get vaccinated until an imam approves. And from South Africa, we have vaccines, death are classified as death from natural causes. Here, suicides are logged as COVID deaths. So they're disputing the numbers. Next, please, Christophe. We have rumors and observation and beliefs from South Africa, Zimbabwe, Kenya, and Somalia. They are saying the vaccine we have is for killing Africans. And we also have, because they haven't been able to reduce the number of children each woman in Africa has, they want to vaccinate us and reduce at the same time. That's a concern from Kenya and South Africa. From Rwanda, Kenya, and South Africa, there's a concern. They're saying if you take the vaccine, the coronavirus will get active in your system. And there's a concern here from 13 countries. They say at the moment, the effectiveness of AstraZeneca has not been analyzed yet. Africa is launching an outreach program for a product whose side effects are not known. Isn't it just the same as calling lambs to the slaughter? So this is a concern which was had in 13 countries about the effectiveness of AstraZeneca. So this the feedback. This is some of the feedback that we get from the partners across the region, and it is from this feedback that we come up with the polls, and the participants choose the next topic for conversation. Thank you very much for participating in the poll later, and back to you, Wayne. Thank you.
Thanks, Tole. That is really helpful in giving us an idea of the scope of the problem of rumors and misinformation that we're facing right now. I'll move on now to our keynote speaker. Abdel Halim Abdallah is the Crisis Communications Officer for the World Health Organization Regional Office for Africa. Halim recently launched Viral Facts Africa, a web resource provided by a network of trusted public health institutions and fact checkers working to make scientific, fact-based health information visual, vibrant, and shareable on social media. Halim's here with us today to discuss the problems posed by COVID-19 misinformation in the East and Southern Africa region, how it affects levels of vaccine hesitancy in the region, and the role journalists can play in mitigating the spread of rumors and misinformation. While Halim is speaking, please feel free to type any question you have for him in the chat box, and I promise we will get to as many of them as we can in this hour. So right now, I would like to welcome Halim. Halim, over to you.
Thank you so much, Wayne. It's such a pleasure and an honor to be with you here today. And thank you all for joining. So I'm going to share my my slides. I have a few slides prepared. Let me see. Let me know when once it's on. Is it on?
Yeah.
Okay. So so as Wayne mentioned, I mean, I think everybody on this call already understands that there is a necessity and an urgency when it comes to responding to misinformation around COVID-19 and around COVID-19 vaccines. It's very difficult to assess the volume of misinformation out of the bigger discourse. But what we're able to do, especially on social media, we're able to track the broader discourse around a specific topic. And in this case, we have used the support of the UN Global Pulse, which is the UN Secretary General's initiative for big data, to help us understand to quantify a bit the amount of content that has been spreading online on Twitter and web-based applications and news sites. So as has been mentioned, in the 47 African countries in the region, COVID-19 has been mentioned more than 40 million times and has been viewed more than 230 billion times. That's since between February last year and March this year. And when we say infodemic, it's not just about misinformation. And infodemic is something that is the surge of information around a specific public health topic, especially during a crisis. And when this happens, this leads into a lot of distrust because there's a lot of misinformation that would percolate or be shared during this surge of information. And there's just too much information. There's a lot of uncertainty, a lot of things that are happening at the same time. So with all of this said, it's highlighting again that it's difficult to explain how much of the misinformation is the percentage of misinformation from the total amount of things that I've mentioned here. We know that the biggest five fact-checking organizations in Africa and they are members of the International Fact-Checking Network, or the IFCN. They have debunked more than 1,300 fact checks. They have produced 1,300 fact checks or debunks of misinformation claims. So in December last year, we have set up this alliance, as Wayne has mentioned, combining the public health organizations in this, working on the response on the ground to the COVID-19, such as WHO, UNICEF, IFRC, Africa CDC, Gavi, and of course other organizations that are also indirectly responding to the pandemic through the response to the infodemics, such as Global Pulse, UN verified, and UNESCO. We created this alliance to also build bridges with untraditional partners. And the fact-checking organizations in the region have been doing a fantastic job in debunking misinformation, correcting lots of claims, and making sure that we set the record straight. So we have started a collaboration with Africa Check, AFP Fact Check, Dubawa, if I pronounce it correctly, PESA Check, and Ghana Fact. The goal of this alliance is to mainly highlight, not just respond to the misinformation, but also to prepare countries in the response to misinformation. We are working through an infodemic framework, which is divided into 4 main pillars: identifying misinformation and information gaps, simplifying the technical knowledge, and amplifying it correctly through strategic channels, and quantifying the impact of that. There are different work streams, mostly focusing around coordination of all of the responding to the infodemic, advocacy, research, country support to different issues of health, etc., and viral facts. And this is the most, I guess, the most interesting part for this group, which is a project that we have launched just on March 30th. The idea is simple. We want to create content that is on social media that is more visual, engaging, shareable across different social media platforms to be able to respond and compete to the misinformation that are taking place online. To the left, you'll see a video that we have prepared with the fact checkers, basically explaining what is the initiative and the importance of responding to misinformation. We have produced a series of social media cards that urge the general public to pause and to take care before they share content online, and to advocate for stopping viral rumors and sharing viral facts. As I've mentioned, there's a lot of misinformation around vaccines. So we have been, almost half of the content that we're producing for viral facts has been focusing around vaccines. As you've seen here, there's a lot, and it's quite important to say that it's not just about misinformation. Again, there's a lot of information gaps. There's a lot of uncertainty. It is quite important to make sure that when to address and to have an effective response to these queries is to have a conversational voice and to be empathetic to people's concerns. So here, this is just around the AstraZeneca suspension. There was a lot of information gaps. We tried to experiment with these different formats to make sure that we reach as many people as possible, and to leverage the network, and to make sure that the are able to share this content as far as possible. We created this new brand to make sure that it's a brand for the people, by the people, to make sure to break the kind of monotony or kind of very authoritative voice that many of the organizations have, tone of voice that they have. It's very formal but more conversational. Even the styles, the fonts and the colors and all of that would be different. And here's just, again, some examples. The reach just for this video has reached more than 280,000 views. The slides or these short kind of story format have been shared by the Sierra Leone Ministry of Health, the UN in Cabo Verde, WHO in Malawi. So it's all over the place. We have developed also through viral facts, we are trying to make sure, again, as I mentioned, to make it more conversational. So we have asked our audience to share with us their concerns, their questions, if there's anything that they would like us to check, to share it on the hashtag VFA check. And we have received a number of questions around vaccine safeties, how are vaccines approved, alcohol and vaccines, painkillers, etc. And we have started already to produce content again to address these different concerns and issues. The key for viral facts is something in real time and quickly and accessible in multiple languages. So what we're doing here is that we have created these templates that would be very easy to fill out, to explain the different content and to link it on After Effects very easily to be able to translate them into very nicely done graphics. This is one of the most viral videos and that we have, and it has been supported by Facebook because it's been a very distinct claim to our region, which is that hot weather, that COVID-19 doesn't spread in hot weather. So all of that and it has been viewed more than, actually at the moment is 9.8 million times as recently as we've checked. And again, the content on vaccines is mainly focused around, we explain the content, we try and break it down and to address the information gaps. There are different common myths and misconceptions that we try to address. And if there's a full-on disinformation or misinformation claim, we try to address it head on. Before launch, we had at least reached, just with our vaccine content, more than 2 million people through the different formats that we have. And that's pre-March 18th. March 30th, apologies. Okay, sorry. So it's as Wayne mentioned earlier on in his introduction, he had mentioned that it's quite important to make sure that we don't amplify misinformation, even if we're trying to report on misinformation or debunk misinformation. It's always very tricky to have a backfire effect where we end up amplifying the misinformation or the person or the entity that is sharing this or creating this misinformation. So one of the things that we've done is that we use the UNICEF Vaccine Misinformation Management Field Guide to, and they have identified, according to research, the best way to respond to misinformation, which is by stating the fact, and then issue a warning, then state the fallacy, and then mention the fact. So this kind of mix really makes it much easier and to create content that is actually effective in responding to the concerns and to the claims. And here, as we have used this and formula and translated it into, again, as you can see to the left here, templates, so we would be able to fill in and create viral facts content as easy as possible and as fast as possible. And even when it comes to, if we want to have further translations or additional languages, it would be very easy to alternate and to change. So again, like just as a quick snapshot until March 26th about the different the performance of the videos that we have been putting out. Again, here you can see that it's half of it is related to vaccines. And this content is from February till March. It's not, it doesn't count the first video that I showed you with 9.8 million views. So Playing with formats is something that is quite important. Again, the conversational kind of style here, as you can see, this is an example with viral facts content, viral facts Africa content that's more like a WhatsApp kind of conversation. We try and adapt and make sure that it's clear and simple and easy to share. We don't do that work in the dark. We try as much as possible to do testing for message efficacy, the content formats, the shareability of the content. And we're collaborating with different partners to do that. With Facebook, we're doing something called the brand lift study, where we share the content with with a group of people, and then we share, then we ask two groups of people, some of them who have been exposed to the content and others who haven't, about their interactions and if they recall the content or not, et cetera, et cetera. So testing is quite important to make sure that we are producing content that is effective. And then also, so anyways, I'm going to skip just to be conscious of the time. Last part is that we are trying to, again, as much as possible, engage with the as many people as possible. So we have started this program to become a viral facts super spreader. And this is a call to different members of the community, from healthcare workers, frontline workers, journalists, celebrities, community leaders, academics, students, and whomever is anyone basically who's interested in addressing this this issue. So sharing and amplifying, there are different ways to interact based on the interest. You could just share and amplify the content, receive the content in your inbox, and you can share it and amplify it. You can become a more of an engaged partner and co-design the campaign, some campaigns with us or some content with us for your audience, if you're an influencer or if you're a journalist or a media outlet. Give feedback to the content that is already out there and say, how can we better adapt it and make more popular cultural references to make it more relatable, etc., etc. How to do that? We just follow our social media accounts, Facebook, Twitter, Instagram. We also have a template, a form that you could fill and to join, give you access to our social media assets in different languages, and it's very easy to use. Here's a quick video that shows how you can do that. And just when we share, we try as much as possible to share with the hashtags Viral Facts Africa, Viral Facts Afrique, and Factos Africa, to make sure that we track the content that we're doing. And thank you for your attention.
Thanks very much, Halim. Before we move on to our next speaker, I do have a question for you. You know, we've seen these what I would say are kind of crazy rumors about COVID-19, that it was caused by 5G technology and 5G towers, that was caused by Bill Gates. There's those that seem wacky, but they've got traction somehow. And then there are the vaccine rumors that there have this actual organized anti-vax movement that is pushing these terrible rumors that the vaccines aren't safe. And then when there's a slight problem with one of the vaccines, like 1 out of 100,000 people have a problem with it, that just kind of feeds into this vaccine hesitancy that we see around the world. How do you treat? I mean, those seem like two different kinds of rumors. One that has a whole momentum behind it with an actual anti-vax movement, and the others. How do you treat them differently when you're trying to debunk a rumor like that?
I think that's a great point. I think we are seeing significant amount of misinformation coming from abroad, actually, from outside the region, fueled by anti-vax movements that are more organized, that are either profiteering or using it for political gains, etc., etc. And for us, it's the same. I mean, at the end of the day, the rumor gets people in our region start believing these rumors because it just strikes a chord with them. They believe because of distrust to different authorities, because these are different issues that we have, and there's a lot of there's confirmation bias as well, because it's just like works on, yeah, this is what I was worried about all along, and here's this person who's saying it, and this person claims to be a scientist or someone who knows about this field. And to be completely frank, it's also, there is this this aspect of a colonial aspect as well to it, is where you have somebody from the West who's saying this, so it's more trusted, and some people would believe stuff like that. On the other hand, we would see people would actually distrust somebody from the West who would say the same thing. So again, like it's a catch-22 where you have both ways. In terms of our response, I think it's quite important to highlight there are the strengths of the fact checkers and the fact checking network that we're working with is that they also tackle, like with AFP Fact Check, for example, it's a global network. And it's very well reputed. It's been there for decades, and it's quite important to know that whenever there is something that has been, for example, there was this one example from West Africa that I remember very clearly. There was a viral video of somebody who was using Coca-Cola to test content on a rapid test from a pharmacy, and then it ruined it. And then this was debunked in France. It was already debunked, but then someone in the DRC, I think a nurse or a doctor who actually used it. This was someone who was dressed in a nice white lab coat, and he was doing it. So again, it adds this sense of trust, or you can trust me because I'm an expert. And he was using the same Coca-Cola test, and it went viral as well. So the initial video did go viral, didn't go actually as viral as the initial as it went in France. It did make it to the region, but not as bad. But then the DRC video went all over the place. So how we did it is that we tried as much as possible to explain it as fast as possible and to disseminate it through the channels where this is being circulated. We did actually two versions, one with the French, the person in the supermarket, and another one with the person in the region and from the region, to try and highlight and explain those two things. But again, like there is no straight answer where we can say we can treat them differently. As much as possible, we try as much as to understand who are these people, what are their motivations, how far is their reach and impact, and to be able to kind of detect that and reach out to the same people, or to the people who have been exposed to the misinformation, to actually try and target them and reach them with the correct information and make it as available in their local languages, in the different formats that they're consuming as much as possible.
Would we have such a big misinformation problem that we have today with this current situation?
I think social media, this is the fact that this is the first pandemic happening in the age of social media, where we're super interconnected, has definitely exacerbated the issue. Previously, we have had other pandemics, and even we have had endemics, and the misinformation has always been there, but it's just like the extent and is now grave and quite acute. I'm sure many of you on this call would remember the boycott of vaccines, the polio vaccine that happened in Nigeria in 2003 in a number of northern states, including Kano, Zamfara, and others, and because due to basically a claim that vaccines caused infertility and vaccines were against Islamic Sharia, and they were haram. So these kind of rumors and misinformation do have real-time impact, and such a boycott had led to derailing the efforts to eradicate wild poliovirus on the entire continent for nearly a decade. So again, like misinformation during public health events is something that's not new. Definitely, just to reiterate your point, Wayne, it's definitely much worse today with social media. It's an area that requires more research, more studies. It's still a new field to try and link exactly between the decision-making of people once they see the misinformation or they're exposed to misinformation online and their actual decisions in real life. It is an area that, as I've mentioned, the Alliance and our partners are very interested in improving our knowledge and better understanding the state of the infodemic, how far is it spreading, its actual impact on real life, real people's decisions from the realm of to real life. So this is just a quick take on that.
Yeah, thank you. Yeah, do you think the social media giants, of course I'm talking about Facebook, are they doing enough to catch this fake news on COVID that's circulating? I mean, a lot of it's coming from outside. I know there are a lot of concerted efforts to hurt the pandemic response worldwide, which is just the nastiest thing I can imagine, but it is there. Is Facebook doing enough to stop it?
I think there are definitely lots of steps in the right direction. Absolutely. We are working closely with Facebook and partnering with them to respond, not just to respond to misinformation, but also to amplify correct information, make sure it's accessible throughout the platform. They are working with the third-party fact checkers, which are basically all the fact-checking organizations that we're working with, to add a circulating or proven piece of misinformation, like a tag on the posts that are going viral and they're wrong, with the fact checks explaining. And our partners are saying that we don't have clarity on the exact number or percentage of posts that have not been shared because of this, but there has definitely been an increase and a dive in those numbers, but the exact numbers are still something that we don't have visibility.
Thank you very much, Halim. Just a reminder, if you have a question for Halim, you can type it in the chat box, and Tole will field that question to Halim a bit later on today. Now I would like to turn to Adele Baleta. Adele is an award-winning science writer and editor with more than 30 years experience. She was the lead facilitator for the World Federation of Science Journalists Infectious Disease workshops for radio journalists in Sierra Leone, Liberia, and Kenya. And she's currently working on e-learning modules for science media practitioners. She joins us today as Internews Pandemic Media Mentor, and she'll talk to us about what we can do as journalists to deal with this deluge of misinformation and disinformation, and to report on it in a way that is going to cut through the fake news and give people the real news that they need. Adele, welcome.
Thank you so much, Wayne, and thank you for the invitation to be here today. I really appreciate it, and it's a great privilege. And thank you, Halim, for a great presentation and for a great new resource. I'm a practicing journalist, like most people on this group, and every day is another challenge. We have to deal with so many different issues, breaking news. Recently, the Johnson & Johnson vaccine, in fact, yesterday, has been paused in South Africa. So we have to be on it all the time. And I do empathize with all of you journalists out there, because it's quite a challenge. So let's have a look at, as I said to you, we have to deal with a huge amount of information, and it's very challenging for us. Not many reporters who specialize in science and health reporting are actually doing the work of covering this pandemic, because reporters have been assigned from other beats. So we've got journalists who are political journalists, sports journalists, because of the need to meet the demand for information, a lot of reporters do not have a science background. So if we don't have a science background, we need to stick to the basic principles of journalism. Meanwhile, what's happening on the ground is that there is a lot of uncertainty, which understandably makes people afraid. If you are uncertain about what time your teenage daughter is coming home or how she's going to get home, it immediately instills fear in you. So it's really understandable that people that do not have answers to their questions in the time that they need to know are going to start feeling afraid. The thing is that with this knowledge gap, with this uncertainty, this provides rich compost for the sprouting of rumors, myths, misinformation, and disinformation. People will start spreading rumors because they don't have answers to questions. And it's just human nature to start looking for and finding answers. And sometimes people will listen to rumors because it feels like it is an answer. So it's really good to try and understand what is happening and why these things are being spread. It was so interesting to me to hear Tole's list of some of the rumors that have been spreading around at the moment. What I found so interesting about that is that many of them have been part of vaccination history for decades. In Africa, we always talk about being guinea pigs, for example, even though that is not true, even though we've seen that clinical trials have been tested in the United States on Westerners, for example. We also saw, for example, on Tole's list, the issue around infertility. Now, that issue of infertility was very much the reason and the cause for why there were polio outbreaks starting in Nigeria and then spreading to at least 10 countries. And it actually put back the WHO's campaign to prevent malaria back many, many, many decades. So what we need to ask ourselves, first of all, is why is science uncertain at times? And I think that that kind of debate and inclusion of that sort of information in stories helps people to understand. Many people don't have basic science as subjects at school, for example. That's not a problem. They don't need to be shamed for it. That is just a question of, you know, what can be provided at the time. So what we really need to do as journalists, I feel, and certainly what's helped me in my reporting, is that I've tried to understand the scientific method and process. I've tried to understand why scientists are uncertain at times. It's not a bad thing. It's a good thing. After all, scientists are looking for answers, okay? That's how discovery happens. So that's why we do clinical trials. We are trying to find a solution. But within that time frame, people get very upset because they want answers, because they can see the effect of the COVID-19 virus. They can see the effect of the disease. They don't understand necessarily the process. It would be fantastic to actually even have a scientist on a radio show talking, for example, about the latest big issue that we are hearing about around adverse events following immunization, the whole issue around the pausing of the J&J vaccine and AstraZeneca. And actually, what's actually happening is that the scientists are being extra careful. That's actually what's happening here. So when we report around the fact that, oh, there must be something wrong with the vaccine, you know, we need to write this, it's going to make a great headline, we might be doing more harm than actual good. Okay, remember, clinical research looks for evidence and facts. That's what scientists busy themselves with. So for me, a golden rule is that no medicine, a vaccine, drug, or even a herbal or natural product can cure, treat, or prevent COVID-19 unless it has been scientifically proven to do so in rigorous clinical trials. And I think that a key message, and certainly one that I use in my reporting, is that the vaccines currently being rolled out now in the world are safe and have efficacy, as has been proven in clinical trials. Do you understand the way that clinical trials work? That's what I ask myself, okay? Can I understand the process? These are important questions. So what can we do? First of all, we can learn a field of research. We can learn the terminology. We don't just feed back the terminology with complicated terms. We can use the complicated terms, but immediately after that, we explain it. Because remember, we have to keep our target audience in mind, whether they are rural audiences or urban audiences. Our job is to make science accessible without losing scientific facts, but that doesn't mean that we have to take the voice of the scientist, because people won't listen. We need to tell the stories. We need to involve the human interest aspect of the story. We need to speak to community members, and more on that a bit later. But we need to find experts for advice and comment. Experts are very important in these stories. We need to find out what risks are involved in taking a vaccine, because the audience are going to ask. That's what they're thinking. So let's provide them that information. Are the risks mild? Are they moderate? Are they rare? What does a rare event mean? Is that very often, to explain that, I use terminology like the risk of a rare event happening is like a grain of sand on a beach, because that is why they are rare. They don't happen often. I also try to explain what could be happening until I get the results from the investigation. Because remember, clinical researchers and epidemiologists and the experts are following the safety of the vaccine from the moment that it is actually conceived of, right to when it's in the arm of a person, to afterwards. So they're still tracking to check for safety and monitoring. And that's exactly why we are hearing stories about safety, about, oh, now we're hearing about blood clots. But that isn't where it ends. The experts are looking at the situation. Most often, it is not related to the vaccine. It could be due to underlying medical conditions. It could even be due to the way that a vaccine is administered. So let's not jump to conclusions and sensationalize stories. We always get blamed for sensationalizing stories. Let's try and stick to the facts. We also need to, when we talk about vaccine risk, we must talk about the benefits. So what is the weighting? Do the benefits outweigh the risks? And I'm very happy and confident to say that as an independent journalist, having looked at data and having tried to understand the story, the actual benefits far outweigh the risks. We need to fact check, and Halim has now handed to us on a plate this great resource, Viral Facts. There are other resources. africacheck.org is another example, for example. But what I'm really appealing to you as journalists, as colleagues really, is that you read, and read. I'm talking about reading scientific papers, getting help to understand those scientific papers. You can ask experts to help you. Read what other journalists are writing about. You will know very quickly who are the good journalists and who are the shaky journalists, because in every profession, there are good professionals and there are shaky professionals. The same is in our organizations as well. So follow the good journalists. There are many, many out there, and they're doing a great job. I also want to talk about something called false balance. Now, you will, I'm sure, having been through journalism school, or actually even just practicing as a journalist, we are often told objectivity, you must get all sides of the story. Well, with science, it's slightly different. I've come to learn that not all things are equal. And I think sometimes we give false balance to the stories that we write, especially on health. So in my stories, I don't seek out the comment of an anti-vaccinationist. I don't seek out the comment of a climate change denialist, because for me, they are not on the side of science. For me, I look for things like, what is the evidence? Show me the evidence. Okay. And then I can confidently go to my community and say, well, here's the evidence. This is what they did. This is how it was trialed. These are the results. This is the more studies that they are doing, et cetera, et cetera. So the one thing I do is I don't give a voice to people that give information on unproven facts and unevidence-based information. So what do I mean by that? Okay. Often it's when we give scientifically invalid ideas equal weight. We need to say, now hang on a second, what you're saying is actually not true, and here are the facts related to it, all right? It's also when we give an anti-vaxxer, for example, or a non-expert. They may not be anti-vaccination, but they may be a lawyer, or they may be somebody that is not a scientific person that is expounding on vaccines. And I see that a lot on Twitter. There are a lot of people that have a lot of opinions about it. And I always check to see, okay, what is your background? Who are you? Okay. So it's a problem when we give an anti-vaxxer equal weight to a vaccine expert. If you think of scales, okay, for me, what needs to be highlighted is what the scientists are saying. The other problem, okay, is allowing the social controversy to seem larger than it actually is. So, for example, if you only interview parents who refuse vaccines for their children, even though well over 90% of parents do vaccinate their children. So why would we want to go to that individual that is apart from the pack, and that actually by non-vaccinating their child is exposing their child to probably more harm than good, in fact, to more harm than good. So how do we fill the gap? We need science-based stories. So how do we debunk rumors? Don't spread the rumor without debunking it. I have seen stories where journalists have said, so-and-so says that the vaccine is being rolled out in Africa because we are the guinea pigs of the world, okay? And then there's a whole interview that's been done about it, et cetera, and there's been no attempt to actually look at that information, to go to a reliable source and to say, no, this is actually not what's happening. We don't say no directly, but you do it through the way that you write your story. Always check who the source of the information is. Journalists rise or fall on the back of their sources. People that use unreliable sources land up in trouble. Think about what is behind the rumor. Could it be politics? It might be one political party trying to vie against another political party that's rolling out the vaccine. It could be an issue of money. Maybe somebody's being paid. We talk about brown envelope journalism in Africa. Maybe somebody is being paid to spread this rumor. There could be issues around jealousy. Who are your sources? Are they experts, epidemiologists, clinical researchers? Who are they? It's very important, I think, as journalists to listen attentively and with compassion. If somebody you interview or somebody comes to you with information that is unevidence-based, that is a rumor, you do not treat them with shame, or I would like to say, as journalists, need not to treat them with shame, to shame them. People often don't have the correct information. Right? Remember, people that arrive for these vaccines, some of them are poor, some of them don't have the kind of education that we may have. They're trying to fill the gap of uncertainty. They may be listening to their neighbors, right? So we need to treat and to listen attentively and with compassion. We can take that information and we can then work out how we will debunk and how we will feed back to community. When there is uncertainty, remind people how to protect themselves in the meantime. Science and uncertainty almost go hand in hand until the evidence is available. But it's important to give people something in the meantime. So in other words, if there is, say, for example, the J&J situation that's happening now with withdrawal, there are things happening. Let people hear about it. Expert investigations are continuing. Causality assessments are being done. The scientists are trying to find what is behind say, for example, the blood clotting? Is it related to the vaccine? And then we can give that kind of information. We can speak to an expert, say, what are you doing to find out? Explain the method, explain the process. And then in the end to say, you know, to have probably the experts saying, we will inform the public once the investigation has been completed. There's nothing wrong with doing that. It's not sparking controversy. It's not spreading rumors. It's actually giving the facts. And yes, sometimes we have to wait for answers. When you bake a cake, you put it in the oven, okay? You have to wait for it to rise. Sometimes it doesn't rise. You then have to find out why it didn't rise. Okay, so there are many angles and hooks to stories. It's important for you to prepare the community for what to expect, okay? I think that's also something that we do in the meantime. So you could actually do these wonderful stories on when your country is going to get the vaccine. Does your country have a rollout plan in place? What does that rollout plan look like? What is government been doing with promotional materials to address issues like rumors, etc.? What about what's happening with ordinary routine immunization programs? Are those continuing? Have you found out if the vaccine, if that there are plans in place for the vaccine to be stored incorrectly? Because all of these stories can immediately draw rumors. So if you're on top of it, okay, and you plan ahead and you think about, okay, the vaccine is coming. Let me get all my sources ready. Let me find out what the vaccine rollout plan is. Let me have people on standby to talk to. Because say, for example, a vaccine is not being stored correctly. That's not the fault of the vaccine, right? It's because it's not being stored correctly. So somebody at some point is not doing the work that's needed to refrigerate or to freeze the vaccine correctly. We need to find out if there's a monitoring system for safety and efficacy after the rollout has happened, which is exactly the kind of stories that we are looking at the moment. And then some tips finally, and that is, and then I'll give you a chip list. Remind your audience that the vaccine is not a silver bullet. You always need to add the fact that people still need to wear masks, okay? Because the vaccine is one part of it. Wearing masks and social distancing needs to continue. Choose photographs to educate, but not to reinforce people's fears. So you don't take photographs of people with really, you know, sort of screwed up faces that are terrified. That's just going to create fear in other people. Put the vaccine data into historical perspective. You know, sometimes we forget that vaccines have been around since, my goodness me, Jenner. When Jenner first discovered vaccines in 1796, they've been around a long time and they have always been controversial. But let's think about making it about information that people can use. That's what's important, because at the end of the day, we as journalists have an audience. Our role, okay, is to pass on evidence-based information that saves lives. Share what experts know based on the available evidence and facts at the time. Explain to your audience that the research is ongoing. Let people know that it's not abnormal to feel ill after taking a vaccine, and you can actually look more up on that, because I think I need to end now. Okay, then finally a checklist. Think about these things. How good are your sources? Who do you still need to go to? Who is your target audience? Will they be interested in your story? What is your knowledge of the subject? Do you know about the research that's going on? What structure best fits the content you want to convey? How and where do you find angles to stories? And very importantly, do you need a training course? Because if you feel that you would like to bolster your information, then go to your editor and say, I've heard about this training course. I think it would be great for me to attend it. Just also to say, and a plug for Internews, we are developing a vaccine training course. It's going to go online very soon. Please watch out for it. It actually covers many of the issues I have spoken about. Finally, I just want to say one word. I'm not saying that you can't interview people who come with a rumor. One thing I thought about was that if I had a situation like that, I would actually see whether the rumor has got traction. In other words, how far is that rumor spreading in any particular community? If it's seriously affecting vaccine hesitancy, if I was a radio journalist, I might consider having a radio show, right? And I would think of, okay, so who would I put on here? I think it would be incorrect just to interview the person that is bringing you the rumor, right? What I would want to do is that I would want to have a vaccine expert, and I would give that person who has the rumor, bring the rumor and explains what's going on and what they think and what their neighbors are saying, whatever it may be. Let them have a little voice, okay? But let the expert speak very solidly for longer, actually, right? And the expert would need to understand that part of your show would be to debunk and to give the evidence-based information. So in that way, you are not cutting out anybody, but always think very seriously about the consequences of your stories. And at that point, I think I'd just like to say that, to say thank you. Thank you very much for listening.
Thank you, Adele. Thank you very much. Before we continue, I'd like my colleague Christophe to launch the poll. And as Christophe launches the poll, I have a question for Halim. Are you seeing a trend? Is there particular rumors that are common across board?
Absolutely. I mean, there are lots of rumors that there are basically lots of persisting rumors and narratives, starting from COVID doesn't exist to conspiracies around Bill Gates and that the West is trying to poison Africans and depopulate the continent, etc., etc. These rumors, they come in waves. So what we've seen since the beginning of the pandemic, we've seen that there will be a surge. Once there is a specific event or a development in the pandemic, there would be a surge in not just in misinformation, but also in mentions around the specific about COVID-19, about COVID-19 vaccines, etc. And then it plateaus for a bit when things stay the same for a while. Even though we're continuing to have new developments almost on a daily basis, or sometimes on an hourly basis, depending on the day. But at the same time, these things come and go. However, they mutate and they change from one country to the other. You would see one rumor that had started in Nigeria, fading down, and then it pops up again in Kenya, and then it pops up again in South Africa, etc. So again, there are different actors, and also we shouldn't forget that the fight against especially vaccine misinformation is not a fair fight, because you see other disinformation actors. You can see influence operations, you can see bots, you can see troll farms. There are lots of other actors who have different stakes into the fight. So it's quite important to just keep these things in mind. And just to echo everything Adele had mentioned, and to might add, is that again the kind of better understanding the motivations of the people that we're interviewing and working with is something that's quite important. And to be able to, many times, especially when picking up tips from social media or stories from social media, it's quite important to highlight, to investigate with the basic fact-checking tools that are available out there, if this is a real person or not, because their job, these bots, their jobs is to sway public opinion and to create this kind of to create these kind of disruptions.
Absolutely. Thank you very much, Adele. Now back to you, Wayne, and kindly continue voting as we go to Wayne. Thank you.
Thanks, Toli. Adele, your talk was fascinating, and I think we could do an entire new session just on that concept of false balance. This has become such a huge issue during the pandemic. It's not just, it doesn't apply just to pandemic. I mean, the people who are trying to deal with the many, many lies of Donald Trump also had to face that conundrum of false balance. But it's a huge problem for journalists who are, like you say, primarily we're generalists. We cover all kinds of different issues, and then all of a sudden we're expected to be experts in medical science, and we're getting good advice from doctors, and we're getting some bad advice from doctors, and how do we report on both without highlighting the bad science? So thank you so much to both of our speakers today. It was really fascinating. Now I want to let everybody know that this dialogue has been recorded, and we will share the link to all of you, so that you can revisit the presentation. It'll be very helpful for pulling out quotes from our two experts to do your own journalism work. In addition to that link, we will also send you the results of our recent Media Dialogue Satisfaction Survey, which is where we get information from you, the journalists, on how you think reporting on the pandemic is going, and how we're doing in sharing ideas of how the media can cover this very challenging subject in the press. So I'll say goodbye now to everyone. Until next time, thank you for joining us. Be safe. So long.
Hi. Thank you.
Thank you all.
Thank you.
Thank you. Bye-bye.
Bye.